Hi, welcome you all. Good morning to everyone. Namaskar. Good morning to everyone. Good evening and welcome you all. So mute yourself and if you have any questions, you can put in chat box. We can take the questions at the end or in middle of the session. It will be around 90 minutes of presentation today. And we will have questions and answers. Then we will share the PowerPoint presentation also along with that. That way you can easily see what's exactly logistics we are going to discuss, all the details. And make sure that you are muted in the background noise is not there because this is the recorded presentation. People who are not able to participate in this conference, in this meeting, then they can visit this link. And we are posting this information on the website, studyayurveda.com. And the last week, we did first meeting that is also recorded and posted on the website. You can see about 2 hours presentation was there last week. And again, now, today we'll have this type of meetings will be continuously going on until we get a cream of the subject and everything. A lot of material we have to cover and various topics to be discussed. It's a big project. It's almost having 21 varieties of that certification programs. from the Ayurvedic lifestyle consultant to the Jyotisha, Vastu Shastra. Those are the meditation, starting with Ayurveda and meditation and the end. So we have a lot of courses are there. So punctuality, time is very important also. We maintain time, on time. And it's very important that when you are living in the Western country, anywhere in the world, punctuality is very important. Punctuality, sincerity, and discipline, and dedication. So, mute yourself, please, mute yourself.
Sir, good morning. Professor Vishnu Sharma from Assam, India.
Yeah, okay, thank you, namaskar.
Namaskar.
So, everybody mute yourself, because this is the recorded. Whatever you are talking, it will be recorded forever. Everybody watching you.
Okay, sir. Thank you.
Make sure that it is recorded forever on the website. Great. Thank you, one and all. Now, I would like to recite Dhanvantari chanting before starting of the session. Om Namami Dhanvantari Madidevam Sura Surair Vandita Pada Padmam Loke Jararubhaya Mrutyunasham Dataramisham Vividaushadinam. So welcome you all for this today's meeting at the Global Ayurveda Academy, USA, Adjunct faculty meeting. In this meeting, we are going to discuss various logistics of the training programs. People who have not attended previous webinar, Zoom meeting, please go to the website studyayurveda.com. Studyayurveda.com. There you can see the link of video clip is there. So it's going on continuously with the several video clips will be there, posted there on the website, Zoom, YouTube links. And everybody mute yourself, and then I'm going to start sharing the screen. Are you able to see the screen? Good. So, okay. Let me make it full screen. More. Okay. Good. Great. So today's meeting here, we haven't listed here. Let me see. Sidebar. Okay, now why we are not. So this is all things we are talked about that. Today, the selection committee and everything we discussed. So today's meeting we are discussing. Today we are going to discuss about the legal strategies and norms and concerns of practice of Ayurveda. As you know that Ayurveda is a licensed profession in India, Sri Lanka, and Nepal. These are the main three countries. Other than that, some other countries are licensed. Some countries such as UAE and as well as South Africa, where they have taken as an Ayurvedic practitioners, BIMS graduates or MD Ayurveda people, as alternative medicine practitioners like that. They are given. The independent practice is not given. So Ayurveda is not alternative medicine in India. Ayurveda is a mainstream medicine also, conventional medicine Ayush ministry, which has recognized as a separate ministry, is there, everything as you know. So now, if anybody studied Ayurveda BIMS course, they always go through the process of 5.5 years of program, 4.5 years of clinical training and practice, and 1 year of a clinical internship that is based on the universities, norms and conditions. They're all affiliated to the universities. So now we have a faculty selection committee members. There are 5 identified professionals. Dr. Ram Mohan Rao, PhD from California, USA. Dr. Manohar Palakurti, PhD, California, USA. Myself, Shekhar Annambotla. Dr. Trupti Gukhani, from MD, Neurology from Illinois, USA. Dr. Pawan Kumar Sharma, MD Ayurveda from Madhya Pradesh, India. These are the 5 faculty members, 5 members who are selection committee members. What we do, we will strategically, we ask you after completion of our webinars and everything, we re-send to the people that to fill the form and ask them that what is the main topics what they wanted to teach. Once we have a complete picture we have given to you, a lot of people, they wanted to teach every subject. Do you have a time for teaching of all the subjects to prepare the curriculum and everything? No. Be practical, be modest, and one specific topic you can teach. Like a BIMS graduate can cure all the diseases. He is an oncologist, he is a gynecologist, he is an ophthalmologist, he is also a neurologist. We do not have identification properly like that. Modern medicine is not like that. So you have to be careful what you are doing, because this is the thing you are doing very clear. What is a specific topic of you are interested to teach? There's a lot of topics can be taught. Now here, all the faculties, identification of the photos, Dr. Ram Mohan Rao, Dr. Manohar, myself, Dr. Trupti Gukhani, and Dr. Pawan Sharma. These are the people who are the selection committee members. You will be seeing these photos frequently, and you may know a lot of people also. Let me see. Next, coming to here, minimum requirements of Ayurveda training for various levels of training as per the guidelines of World Health Organization, Ayush Ministry, Government of India. These are the gold standard training programs as created by the World Health Organization as well as Ayush Ministry. Somewhere we have to take some guidelines. That is not necessary that they are standard completely worldwide. There are norms and conditions are there. Every country has to follow rules and regulations, and World Health Organization does not have a control of a licensing authority to give licenses for the individual states or individual persons. So if somebody says that I am BIMS licensed by the World Health Organization, sorry, licensing authority is different, standard education is different, and accreditation is different, everything is different, ministry is different. So BIMS degree, when you get it, that is from the college gives the certificate. From college, that is affiliated to the university, you are affiliated to that university, university gives a certificate. There is a separate registration board. Once you completed, then you have a registration board where you get the license of the registration. Once the license is done, then you have to follow the norms and conditions of your state, where you are practicing in your country, in your state, where you are practicing, whether it's a county or a state or place where you have to have a license of business license to practice. And ethical guidelines you have to follow. Illegal, unethical things if you are doing, you will be suspended and also revoked your license also in the countries like that. So these are the conditions one has to remember properly. Basic training programs in Ayurveda. So what we did it, we have come up with Ayurveda certification programs, level 1, level 2, level 3, level 4, level 5. These are the 5 levels of the program. So level 1, we wanted to make it clear for the people because we do not have, so probably we have a level 4 directly BAMS graduates who are going to the advanced Ayurvedic practitioner level, that is the BAMS level. MD Ayurveda, MS Ayurveda people who are masters in Ayurvedic specialists. And PhDs, of course, there is an academically, they are doing some PhD work and everything. There is a category, separate category like that, because in India is different 3 levels, basically BAMS, MD Ayurveda, MS Ayurveda, PhD Ayurveda. These are the 3 categories are there. So here, you can't implement the BAMS course in the other countries, various countries, because the plantation and the availability, drug availability and everything is impossible. Clinical setups are different. So hence, we have to educate various levels of people. Ayurveda is getting popularized, globalized. Ayurveda is more and more accepting. All over the, not only one country. Today, I am getting a patient from the Hawaii and Slovakian and living in Hawaii and coming to see me. So there are various ways to people are following like that. They are educators. So for that, basic level is Ayurvedic lifestyle consultant. Ayurvedic lifestyle consultant means what is the things their role for their lifestyle management, like Dinacharya, Rotacharya, and all these things they are following systematically. So what is the benefit of taking this course? This is the basic level of the course. 500 hours of training program will be taught. In the 500 hours of program, they will be not knowing about more plants and medicinal plants and everything, the medicinal usages and everything, but they should know about their day-to-day chores, what they can do it, how to implement their lifestyle and changes and everything, Dinacharya, Ratricharya and everything, yoga, basic pranayama techniques, meditation techniques, everything they should know. They should have a strong practice. Does they allowed to practice on other people? No. They can practice on themselves. Even they are not allowed to practice on the family members also. Because then again liability comes. So you have to take a very clear picture here. This is self-development, self-knowledge. So this is a clear picture. We are not giving any licenses for these people. They are giving a lifestyle entry-level program. They are understanding the dosha, dhatu, malas, and everything. Will go through the process. Next, Ayurvedic health coach. After 500 hours of training program, now they will should know about more anatomy, physiology, and everything. More basic level of herbs, safe herbs, like for example, Triphala, Tulasi, Ashwagandha, Shatavari. These are the simple herbs. And culinary herbs they can learn, and Ayurvedic health coach. Does they allow to practice on the people? Yes, with the close people who are there and their clients and everything. Health coaching, they are giving health coaching, health awareness they are providing to you. Now, third level, it goes to the Ayurvedic practitioner level, where you have a more training program, more clinical training is there, more case presentations and everything, they will do it. Then fourth level is the advanced Ayurvedic practitioner, which is very close to the, similar to the BAMS level training program. That is almost 4,000 hours of training program. So can we call it a BAMS degree in America? No, because BAMS degree abbreviated as a Bachelor of Ayurvedic Medicine and Surgery. Medicine and surgery is not allowed legally in the unlicensed countries. That means if you are practicing surgery without having a proper license, you will be legally binding and prosecuted. You can be in jail, lifetime jail for imprisonment. Because practicing Ayurveda in a smart way is very important. Not stepping into the other practitioners. So BAMS degree is not a valid degree in the other countries unless you have a license is there, complete license is there. So what is the scope of practice of the Ayurveda? We will talk about more and more details about this, because I wanted to clearly understand a lot of people who are having and not knowing about that. They wanted to come to suitcase, take a suitcase and come to America and practice. No. That doesn't happen. That's the thing. Then master level program called is an almost like MD Ayurveda. This is almost 8,000 hours of training, full training program, not like online courses or something they are doing. Of course, now technology has changed. Now a lot of courses can be taught online. Even the engineering courses and everything courses also they taught in the nursing schools and everything, medical schools and everything, they teach online courses also. There's a theory part they teach online, and practicum, they have to come to the clinical rotation, they have to come. That can be done same way in India also. Some of the courses can be taught online, and then students can come to the colleges in a minimal time and to learn more clinical training program. So what is happening there? Morning to evening, we are bombarding with the students 9 to 5. They get tired 6 days a week, and they are not getting anything knowledge like that. Only theory knowledge they are getting. And hospitals, a lot of hospitals are not empty, and the patients are not able to. Some hospitals, I am not saying that some hospitals are full, somehow majority hospitals are empty because clinical practice is not there. The confidence of the BAMS graduate who comes from the college out, they are not confident to practice Ayurveda, then they are going to the allopathic practice or something like the allopathic practice is. This is a practical truth. It's a truth factor is there. I'm talking about that. I'm not insulting anybody, any organization, any setup, or any government authority. I'm not insulting anybody. I am be frank. I wanted to be clear what is the practical things are happening there. Because I visit as an adjunct professor in the universities, various universities I come. First of all, I don't need to see the building. I wanted to see the clinical practice, their hospital setup. I wanted to see the hospital where the patients, how they treated, how they think, documentation. This is the biggest thing I always check them. Then next coming to the specialty subjects, such as specialty Ayurveda subject. For example, Ayurvedic lifestyle consultant, his passion towards going to the Ayurvedic food and nutrition. They wanted to work in the restaurants, hospitals as a cook, preparing the food. Cook is not an insult in America. In India, is degraded like that way. Without food, without cook, one day cook is off, then you can't eat any food. Cook is not a remote, these things. The janitor is not an insulted position. Or shoemaker is not an insulted position. If without shoes, how can you walk? So every profession having its own dignity of labor is very important. So you have to respect everybody, every profession, and every person is required. So next, Ayurvedic food and nutrition program, that is also 500 hours of program. Now coming to the every course, you have created a 500 hours of level program like that. First basic level they have to complete. That means a food and nutrition consultant must have 1,000 hours of training in that specialty. So totally adding to the lifestyle consultant plus 500 hours of a food and nutrition program. Next, coming to the Panchakarma therapist, again 500 hours. Marma therapist, 500 hours. Beauty and spa therapist, 500 hours. Yoga therapist, Ayurvedic yoga therapist, 500 hours. Ayurvedic herbalist, here as we are talking about Dravya Guna specialist, and in addition to that, they are learning about the basics of the non-metallic preparations in the Western countries. Like for example, they wanted to learn about corals. Those can be learned. The Mukta, Shukti, and those type of things are non-metallic supplements that can be used now. And Ayurvedic pharmacist, who is a Vaishajya Kalpana and Rasa Shastra expert, and aromatherapist, Gandha Chikitsa, which we call, and doula is between the midwife and nurse practitioner. Between that, doula is not a licensed profession, but still they are practicing as a doula, as a supporting for the pregnant woman, prenatal care, natal care, postnatal care. During that time, they can take care about that. Then polarity therapist, who is 500 hours of training, the polarity, energetic levels and everything looking for that way. And even they have a little bit of training of pranic healing, Reiki healing, those type of things also, additional trainings are required like that. And psychology consultant. So they are not psychiatrist or a psychologist. Psychology is a licensed profession. and mental health and marital counseling. Those are all licensed professions. Whereas a psychology consultant, Manasa Shastra or Manovignan, they are talking about the Bhuta Vidya and those type of things. They can talk about that. Non-pharmacological way, they are giving the formulations and everything like that. Then Vedic Vastu consultant, Vastu Stapati or Stapatya Veda, Vastu consultant, how the orientation, the house and buildings and everything, practice and everything, that can be taught in detailed way in the Vastu consultant program. Ayurvedic astrology consultant. So astrology is the Jyotisha Shastra, is also unique, very advanced level of training, but they should have basic lifestyle consultant program training is required. In addition to that, 500 hours of additional full training program is required in the licensing. There's no licenses there, and anybody can practice that way, but if they have a thorough knowledge about that. Now coming to these things, scope of Ayurveda for various levels of training, for the guidelines of the basic training program. Now we are going to discuss about the basic levels of program. Ayurvedic lifestyle consultant, an entry-level training program in Ayurveda with a minimum 500 hours of training, including basic Western anatomy and physiology training. So they should know also basic anatomy, physiology, also in the anatomy, physiology, Western anatomy, physiology, like in a skeletal system, musculoskeletal system, and organs and everything they have to learn, and basic understanding about the physiological conditions, what is the normal condition, what is the blood pressure normal, and ESR levels and blood work and everything. Small basic levels they have to know about these things. Then Ayurvedic lifestyle consultant, scope of practice. Ayurvedic lifestyle consultant, which we call as ALC, is an introductory beginner's course for all people interested in Ayurveda. That means all patients can be enrolled. All the homemakers, they can make it. They don't need to practice, but they can develop self-development. So I always say that the person who has a head, they are allowed to join in the program. Head and neck is there, they can allow to join in this Ayurvedic lifestyle consultant. That means how much population we can teach Ayurvedic lifestyle consultant program? This can be taught in India, 1.4 million, 1.4 billion population. That means worldwide, 7.4 billion population we can teach Ayurvedic lifestyle consultant. Then only we can consider as Ayurveda is a global medicine. Until that, we are not going to reach there. So statistically, we need to look into the World Health Organization with Ayush Ministry and Global Center. We have to train them 500 hours of training program for all over the world. Your lifetime is not sufficient to train them 7.5 billion population in the worldwide. Can we able to reach them there? The basic level training program. This program we can teach in the medical schools also. A lot of medical students, Western medicine students, they are not aware about that. This system of medicine is there. Ayurveda can be taught. An individual who has obtained the certificate may practice self-healing. It's very important here. I'm going to talk about the self-healing. It's not allowed to do on other people. Ayurvedic lifestyle consultant. This scope of practice emphasizes education on the presentation of imbalances, the Vikriti, and the promotion of wellness on the level of being using the life-enhancing modalities and philosophy of Ayurveda. Life-enhancing modalities are very important to these things. How to become more happier, more healthier, how to live. We have a birthright to live happy and healthy. Birthright. So we have to make sure that everybody enjoys this thing. Approaches, individual appropriate dietary, lifestyle, yoga, meditation. So they should know all these things. So with the pitta imbalance condition is there, Shitali pranayama. Vata imbalance is there, Brahmari pranayama. Kapha imbalance is there, Bhastrika pranayama or Kapala bhati, Ujjayi pranayama. They should know about these things. What type of meditation can be given? A Kapha person, you give relaxing meditation, he will fall asleep. If you give a guided meditation or strong meditation, then he will keep them alert. So that means Kapha person need to have more focused meditation. Vata people need to be guided meditation. They will be wandering mind. So you see the variation is there according to doshas. Variation is there. Vata person is different. Pitta person is different. Kapha person is different. Meditation can be taught in different ways. The pranayama taught differently. Yoga can be taught differently. Lifestyle, diet can be changed according to their conditions like that. Vata balancing food, Pitta balancing food, Kapha balancing food. For example, a Pitta guy comes to you. Can you give a chili powder for him? No. Black pepper can be given? No. So make sure that you are giving the sufficient way, a proper way of doing like that and everything like that. So Vata guy can eat a popcorn? No. Popcorn, he can eat it if adding of extra sweetener, a cream, oil, then Vata will be reduced. So Kapha person can allowed to eat popcorn without having any salt, added salt. This is the giving examples to you. Okay. So next, the certificate allows for designing preventive health routine for oneself. So this certificate also allows the people to self-awareness. Self-awareness is very important. Assessment tools are used to enable determine the prakriti, an individual's body, mind, and unbalanced state of doshas, ama, agni, dhatus, and malas. So concepts are very important. We are not training them to become as a medical doctors. We are not making them as the medical doctors. We are making our principles of Ayurveda, Panchamahabhutas, Dhatus, Malas, Agni, Ama, Prakriti, Vikriti, and all the different things. They should know all the terminologies to be carefully to understand. Those who have obtained this certificate do not practice conventional medicine. Conventional medicine means allopathic medicine, Western medicine. Conventional medicine here, the Western medicine. So they should not practice the Western medicine with this certificate. They do not treat diseases. They don't diagnose the diseases because they don't need to know about samprapti and pathogenesis, all the disease conditions, the various conditions. They don't know. That's the reason they are not allowed to diagnose. So this is the scope of practice of the Ayurvedic lifestyle consultant. So know clearly about what you can do it, what not, what can be done, what cannot be done. This is the thing is very important like that. A lot of people, when they join the Ayurveda schools, oh, I'm allowed to do surgery. Are you a competent person? Are you able to show your competency before the surgeons? Able to successfully do it? No. If you are not competent to do it like that, then you are not allowed to practice. Make sure that this is the thing is very important. Next, Ayurvedic health counselor. Ayurvedic health counselor, 1,000 hours of training. That means what we are doing here, 500 hours of training. In addition to that, we are adding extra 500 hours of training. So that means 1,000 hours of training is required. Prerequisite is that they have to have a lifestyle consultant certification is there. The scope of practice, Ayurvedic health counselor, here on we can AHC, has completed their Ayurvedic lifestyle training and actively implements Ayurveda into their lives. So a lot of people, what do? They do not practice their lifestyle changes. Still, they are practicing. So how many of you wake up about Brahmi Muhurte? How many years back you studied BIMS course? How many years you are practicing? How many people are practicing systematically, wake up in the morning and doing yoga, meditation, breathing techniques and everything you are following? First, question yourself. Question yourself that whether you are practicing or not Ayurveda practitioners. This is the thing what we wanted to do it. Every practitioner should wake up early and make a discipline of their practice and everything. We are also going to ask when you are taking the adjunct faculty members, whether they have any bad habits, smoking, drinking alcohol, or abusing of the women. self-inflicting things, that also can be taken into the consideration. They have to clearly written there that in the statement that they have to have no addictions are not there. If they are drug addicted or anything like that, they are following. Whether they are following the regular practice of yoga and everything, that is also important like that. If you are not practicing, how can you teach others? If you don't know how to cook the food, how to offer you to others? This is the thing is very important that we wanted to make sure that this is the very critically we are doing. Everybody asking that, sir, when are you going to start the program? I'm going to ask you a question. This is a question. Since how long you are practicing yoga and meditation and relaxation techniques? This is the thing important. So the scope of practice. So this Ayurvedic individual who has obtained the certificate works with may offer Ayurvedic wellness services to their clients. So wellness services, they can provide wellness services, how to enhance the longevity of life, not to change their medications. This is very important in this country. It's very important that if a person comes to you, he is already taking hypertensive medication, synthroid medication, hypothyroid medication, thyroid medication they are taking, or sugar medication. These are the common medication they take it. Okay. They should not ask them to stop it. How to enhance that way? For example, a thyroid patient comes, you can teach yoga, lifestyle changes, salt intake, all the dietary things, and what are the basic things can be given to them. What are the lifestyle changes can be bring it to them to improve their quality of life. What medical doctor is not advising, we are advising them. What we advise them, the medical doctors are not advising. The Western trained doctors are not advising those things which we are training them. So that way, holistic approach. Ayurveda is a holistic approach. It's complementing each other. We are not having any conflict between the medical doctors and Ayurvedic doctors, BAMS doctors, the MBBS doctors. There is no conflict. There's different streams of trains are there. One is the express train, one is the passenger train, and a goods train. So different trains, but everybody taking the same track they are taking, same train, railways they are taking, all are traveling same thing. Like same thing with the road is constructed. Road can be constructed for the bus can go, bicycle can go, the walking person can go. Same way, the system of healthcare is there, but we are not conflicting each other. There is no question of a confliction of each other. We are brothers and sisters of all systems of medicine. That is the way we have to look into that. That is the only way, best way to practice. And as needed, you have a guts to refer the patients to the medical doctors also. A lot of times we refer them and they refer to us. A lot of medical doctors, they refer the patients to me and I refer the patients to them also. That way mutually understandable like that. We are exchanging the patients like that. And this certificate allows the designing the preventive healthcare routine for self and clients. Assessment tools are used to enable determine the prakriti, individual's body and mind, and balanced and unbalanced states of doshas, ama, agni, dhatus, and malas. And of course, sattva, rajas, tamo, gunas, and everything, gunas also can be assessed like that. Those who obtain this certificate do not practice conventional medicine. We are repeatedly saying these words, very, very important like that. One has to not to practicing this type of things. They do not diagnose the disease also. They do not diagnose and treat the disease as Ayurvedic lifestyle and health counselor. Next, coming to the Ayurvedic practitioner. So that means level 1, level 2 completed, then they are going for the 2,000 hours of training. That means their additional training program, they are taking prerequisite of 1,000 hours. That means what is the thing is clear, 500, 1,000 hours. Then additionally, they are taking 1,000 hours of training. Ayurvedic practitioner means they should have total minimum 2,000 hours of training is required. Ayurvedic lifestyle consultant, practice, health counselor, and practitioner. So here The scope of practice for the Ayurvedic practitioner is an individual who has obtained associate in Ayurvedic medicine degree or certificate may provide guidance of the individual with imbalances. So here, Ayurvedic practitioners, we will wanted to have a minimum 12th standard, they have to completed, high school completed, they have a completed training program. In addition to that, they have a strong foundation of anatomy, physiology, all the different courses they have completed. They construct health interventions through the traditional principles of and practices of Ayurvedic lifestyle changes, because they are already practicing health coaching and everything they are doing, and lifestyle management they are doing. Now they are able to become a more Ayurvedic practitioner. Their scope of practice emphasizes educational imbalances and regaining the wellness of individual well-being and using modalities of principles of Ayurveda. They must have completed Ayurvedic lifestyle training with the additional education, Ayurvedic lifestyle consultant and practitioner health counselor program there, and body pathophysiological imbalances should be there. Samprapti Vigatana and everything they have to know how to break the Samprapti and everything that can be knowing about that. So all the different disease conditions, Madhav Nidana and all the different textbooks, they can read it. They utilize the personalized diet, lifestyle coaching, yoga, meditation instruction, and use of herbs and oils using the Ayurvedic approach. So dosha balancing, that oils and spices, condiments and herbs and everything. They also assessment of the tools to determine the Vikriti, imbalances of individual body, mind, and work to realign the imbalanced state of doshas, ama, agni, dhatus, and malas, and everything is important. They have formal educational training as a BA and BS training program and developed critical thinking skills over the several years of training and evaluation from the Ayurvedic experts. So why we are asking that high school graduate, until high school graduate, we recommend them to go for the Ayurvedic health coach. The high school graduate means here is the 12th standard people. When they have a BS degree, BAMS degree, the BA degree or BS degree, that is the thing, engineering faculty people, they have a critical thinking is there, more awareness is there. So BS graduate, for example, 21 years, around 21 years, they complete the 22 years, they complete the BS degree program in America and other countries like that. So those people can become Ayurvedic practitioners like that. This individual having ideal person to visit, someone is looking for a coach to guide him or her through the general wellness routine, design individually tailored health routines, and can coach the client into the Ayurvedic principles. So here, again, the coaching is very important. We have to educate them, not like, oh, Dr. Shekhar, I see the patient 60 minutes, 60 patients. How can you see the 60 patients in 60 minutes? Per minute, one patient. Here in America, we do one patient, 1 hour. 1 hour we spent. So average, how many patients we see? If you are working for 10 hours, 10 patients you see them. That is the difference between the Western countries, how you educate them like that. So because you have to do all the activities them and individually help them to enhance the quality of life. This individual does not practice conventional medicine, allopathic medicine they should not practice. They should not diagnose, treat or cure the diseases. Okay. So here diagnosis treatment is not allowed for them, Ayurvedic practitioner level. Now coming to the 4th level, advanced Ayurvedic practitioner, AAP, Ayurvedic doctor, which we call. Also, some of the countries, they don't allow the degree word as the Ayurveda doctor word. So this is the minimum training program. 4,000 hours of training is required. 4,000 hours of training is required. That means they have completed 3 levels of training: lifestyle consultant, health counselor, a practitioner, all the 3 levels. That means 2,000 hours it comes. In addition to that, they are taking about 2,000 hours extra training program, double the training program they are taking. 4,000 hours of training is required for them. So what is the scope of practice? Here, scope of individual who has obtained Bachelor of Ayurvedic Medicine and Surgery, BAMS, may provide in-depth guidance to individuals with imbalances using the modalities of philosophy of Ayurveda. So Henceforth, what we are doing, all the BAMS graduates in the Western countries who are practicing, we are giving as a degree as called RAAP, Registered Ayurvedic Advanced Ayurvedic Practitioner. RAAP. That means register. Their registration with the APNA, Association of Ayurvedics of North America. Once their qualifications, for example, somebody brings the degree, like recently one guy brought a degree, BIMS degree, and I have seen the abbreviation there. Bachelor of Alternative Medicine and Surgery. No, not surgery. Bachelor of Alternative Medicine and Sciences, Medical Sciences. That's a BIMS. Abbreviation can be given different ways. Okay. So you have to be careful what type of degrees they are giving. Calcutta Board of Alternative Medicine gives certificates. MD Alternative Medicine. Does it recognized by the Ayush Ministry? No. Can we take them as an MD Ayurveda as a graduate like that? No. Same way, we have to be careful that degrees, fake degrees are coming out of the market like that. We have to be careful scrutinizing these things. And when the person is there, and sometimes we check with the universities whether they are qualified or not, whether they are recognized, that degree is recognized or not. And their scope of practice, including constructing these things, principles and everything, they understand pathophysiology, complete pathophysiology of the every disease condition like that. That means Samprapti, and in the individual Samprapti can work alongside with the modern medical practitioners. So these are the people, the advanced level of Ayurveda practitioners, that they can able to communicate with the medical doctors, that BIMS graduates who can able to communicate and explain to the medical doctors what is the thing is there, and they will able to tell them that, sir, you are looking for this immunoglobulins or ESR levels are high. In Ayurveda, we look into this way, and Ayurveda, we recommend to give Haridra Khand. Eosinophils are there, more eosinophils are there. I am going to give Haridra Khand for this patient. How long we are going to give? We have to clearly. How much dose you are going to give? That is also. Or Lakshmi Vilas Ras, Sitamsa Ras. Something you are giving, and eosinophil rates after using of this medication or drug, then it has came down. That has shown some improvement in the eosinophil count, ESR levels, or iron levels. For example, a person comes with an iron deficiency, and you are giving Mandura Vatakam or Lohasava, or something medication you are giving to them to improve the quality of their life and everything, then you are seeing the situation like that. So that is the modern way of communicating with the doctors and everything. They have a formal education of bachelor degree with the level of developed critical thinking skills over several additional years of training and evaluation of the in clinical Ayurveda. They have completed both previous levels of the Ayurvedic training and additional theory and clinical training experience, understanding how to manage imbalances. So this type of training, advanced level of Ayurvedic practitioners program, they need to have more and more clinical cases and everything. They have to do it. They can manage diseases and understand USA and Canada and Europe. These are the BIMS graduates who have completed the program and everything. They can manage the conditions, the various conditions like that. So that's on a more based on the laws needed to adopt, practice, and providing care legally using only modalities available in their own country, localities like that. So they have to be extra careful what type of practice they are going to do it and everything. This is also beneficial for the BIMS graduates who are brand new people who are coming from India and they are practicing here. They should be aware about that legalities and everything. Otherwise, they will be having a legal implications can develop like that. Next, doctor of Ayurvedic medicine. Here is a very critical point is that, so doctor of Ayurvedic medicine, a lot of times people, they consider that I did my MD Ayurveda from Gujarat Ayurveda University. A lot of people, they think that I'm a medical doctor. No, I am not a medical doctor. A lot of patients, they ask me also, are you a medical doctor? No, I'm not a medical doctor. I am not trained in the Western medicine, conventional medicine doctor. So is there 8,000 hours of training we have completed, BIMS level, And in addition to that, MD Ayurveda, who is having a 3 years of program, my specialty in Kaya Chikitsa, where we studied MD Ayurveda, MS Ayurveda, PhD Ayurveda, recognized Ayush, Government of India, to distinguish between the Western trained MD, medical doctor, will need to institute DAM degree as an Ayurvedic equivalent MD in Ayurveda modern medicine. The DAM degree will provide a clear distinction between the benefits of the public and medical profession and government. So a lot of medical doctors, health professionals, universities, and all the people are confusing with this MDIU. MDIU, IU, they think about that this is one country. MD Argentina, MD Thailand, MD Russia, MD Slovenia. MDIU is a different country. They think about that. So that is the reason we have to be clear with them that we have to clear the degrees like that. That's a big confusion is happening like that, equal in degrees like that. So it's a very important that also this rethink about that. Ayush Ministry also should rethink about that, giving the degrees like that. Instead of giving the MD Ayurveda, confusing like that, degrees like that. MD Ayurveda, MD Unani, MD Homeopathy like that. Why allopathy people are not getting degrees of MD Allopathy? They are not getting MD allopathy. They are calling themselves as MD. Why we need to call it MDIU? Additional writing. Doctor of Ayurvedic medicine. Doctor of Homeopathic medicine. Doctor of Unani medicine. We wanted to recognize our degrees means qualifications properly given that. Then there is no confusion. DAM, DHM, DUM. DYM, Doctor of Yoga Medicine, Yogic Sciences, DYS. So that is the thing we have to clearly distinguish between. We don't want to public bluff them. Oh, we are MD doctors, medical doctors like that. No. It is a shame on us to say ourselves that I'm an allopathic doctor. We studied for Ayurveda and practicing 50 to 60 years of practice and everything like that. Why we should have defame our system of medicine? Why the defame is there? Degrees has to be given, no confusion for the public. And a lot of times, some of the BM, MD, people, they write very small letters IU. MD big letters and IU very small letters. In parentheses. They wanted to show that they are trained medical doctors. By putting the stethoscope and white coat, you will not become a doctor. Anybody can buy the certificate and these things like that. The stethoscope, you can become like that. Make sure that our critical training is important. These things. Hopefully, the Indian government can recognize, Ayush Ministry can recognize that degree. This confusion is happening there. This can be degrees can be changed. And this is the problem is coming globally when they are going out of country. People are there. And around the globe, this is the practical problem is coming for all the PAMS people, MD Ayurveda people, MS Ayurveda, no problem. PhD Ayurveda, no problem. MD Ayurveda is confusion. So we need to change the degrees like that. An individual who has obtained masters in Ayurvedic sciences may provide in-depth guidance to individuals with imbalances using the modalities and philosophy of Ayurveda. Their scope of practice including constructing health interventions and provide education and imbalances using the traditional practices and practice the Ayurvedic way of lifestyle. They understand pathophysiology and can work along with the modern medical practitioners. They have a formal education at a master's level training program and developed critical thinking skills and several additional years of training and evaluation of clinical Ayurveda. They have completed all levels of Ayurveda training program in addition to the additional theory and clinical practice, understanding how to manage the imbalances. Even they have a research facility also there. They have studied the medical statistics and everything they studied. They have written a dissertation, thesis work and everything. They are specialized in this one subject like that. There are something like that. Now, NCISM is coming up like that, more specialty degrees, oncology, MD Ayurveda, and and the super specialties like oncology, neurology, ophthalmology, and everything is coming. Ophthalmology and Ayurveda specialties like the specialty subjects are coming, and cataract specialist and glaucoma specialist like that. These all the different specialties are coming up like that. Specialty degrees are coming. They have additional in-depth knowledge within their field of specialization. They can manage diseases, understand the USA, Canada, in the USA, Canada, Europe-based laws needed, adapt their practice and providing care legally using only the modalities available in their countries, in their places. Then the individual does not practice conventional medicine, Western allopathic medicine. So a MD Ayurveda person, even though studied Western medicine, does not practice allopathic medicine. So it's very interesting that one of my professor, we are all having a clinical training program in addition to the Ayurvedic hospitals as well as allopathy hospitals. We go there, that is civil hospitals in India we call, and allopathy hospitals, they train them there. One of my professor asked that the ophthalmology department, head of the department ophthalmology, you BIMS graduates, just come and watch here patients and you practice allopathy. And he got upset with that. One of my professor, he got upset with him. Sir, we are not here to practice allopathy medicine. We are seeing the cases. What is cataract? What is pteresium? What is glaucoma? What is tie? Various conditions we are seeing, because you are getting more cases here. We wanted to see the cases, what is the differences there, where we can do, and when to refer to you. When to refer to you. So that is the reason we are studying of these things. That immediately he appreciated, the professor appreciated, the ophthalmology head of the department appreciated our professor, and I appreciated my professor, how he dared to say it like that. We are not here to practice allopathic medicine. We are here to practice, if you are able to cure cataract with Ayurvedic medicines, I will give an award for you. If you are able to cure the glaucoma with Ayurvedic approach, I'll give an award for you. Not surgical procedure. If you cure the Parkinson's disease with Ayurveda, not with dopamine or something like that, conventional medicine is taken out, we'll give an award for you. This is the way we have to encourage our people. The government of India, all things they have to give. What is the purpose of giving this degrees and everything, awards and everything, that thing? If you have cured certain diseases, a blind person comes, you are make them to macular degeneration or something happened through Ayurvedically, you are able to cure it. You need to possess the Padma Shri award. Not teaching of 50 years of teaching of Ayurveda in the colleges, everybody is teaching. That is not a person possesses the Padma Shri award. So that is the thing we need to think about that way. Now, here a lot of people think about that, this integrative Ayurvedic practitioners, that is called IAP, IAD, integrative Ayurvedic doctors. For example, a medical trained doctor, MD, who is interested in Ayurveda. Those people who are interested in Ayurveda, they wanted to practice and focus on these things. And then 2,000 hours of training is required. Vishnuji, you can take out the photo. So 2,000 hours of training, prerequisite as an Ayurvedic practitioner, and 2,000 hours of all licensed health professionals, medical professionals, and having allied health professionals incorporating Ayurveda into their healthcare practice. So that means here, a medical doctor, MD, DOs, and DCs, chiropractors, and ophthalmologists, and all the specialties people who are there, those people can be eligible to practice this type of IAD, not I'm a licensed aesthetician. I'm a licensed massage therapist who has high school graduated. Now I wanted to become an Ayurvedic, integrative Ayurvedic doctor. No. They should have a degree in the program and medical degree program. And like, for example, we have here one of the selection committee member who is an MD neurology specialist, Dr. Trupti Gokhani. She is a right candidate for here. An individual who has obtained Ayurvedic practitioner training program, Ayurvedic advanced level of programs and guidelines of the individuals and practices like that. They construct individual health principles of Ayurveda. These are the MDs and DOs, DCs, NDs, naturopathy doctors, and all the principles they are following. And these individuals also practice and they also formal training in Ayurveda, tailored these things. The individuals does incorporate Ayurvedic medicine in their respective practice, provide the fullest extent of the care. That's the thing we are training them that are fully trained, almost like in a full training program, like a BAMS graduate, how much the training program is there, very thorough program, similar training program, medical doctors also getting. So there is a World Health Organization has given guidelines, postgraduate diploma in Ayurveda, PGDA. PGDA program is almost like a 2,000 hours of program, which is very geared towards the medical doctors and health professional, allied health professional. That is the 2,000 hours of training is required. They have a thorough knowledge about the philosophy of Ayurveda and knowledge and everything. Not like 500 hours of training like that. So 2,000 hours of clinical training, full training, fullest training program, they need to take it. Next. Oh, sorry. So next one is the integrative Ayurvedic researcher. I am giving example for you, 1,000 hours of full training program. The person who has a training program in research in Ayurveda. For example, Dr. Ram Mohan Rao, who is one of the selection committee member, who is a PhD. PhD in not in Ayurveda, PhD in Western science, in neurology, neurobiology, or something medical knowledge like that. They have medical background is there. And in addition to that, integrative Ayurvedic researchers. These are the researchers who can collaborate with the Ayurvedic doctors and work with them. And they have PhD in health sciences and they can practice that. They are not practicing conventional medicine. They are not diagnosing any treatment or diseases and everything like that. They need to know about complete understanding about dosha, dhatu, mala, and vikruti and vijnana, everything like that, properly like that. So now, coming to here. Okay. So, scope of Ayurveda practice for the various levels of training as per the guidelines of the Ayush and World Health Organization specialty training programs. So I'm going to stop here and specialist subjects, and then we'll take questions and answer session, and then we'll continue this specialty subjects. So. Good. So make sure that it's very important. And when you are putting a video, not picking your nose, cleaning your nostrils, and dancing there and changing your clothes, those things don't do it. Because everything is recorded. How many times picked up your nose? That is also seen. Make sure that your clarity is there when you are, take out your video. That's very important. This is the professionally maintaining recording like that. Professional things are there. Discipline is very important here. If you have a practice is there, then what you do, you stop showing video and do it only photo show them like that. Any questions here? So we have about 42 participants here. Is it clear? For everybody having clear? So let me see any questions here, chat box. Okay. Good morning, good morning, good morning, good morning, good morning. Okay, good morning. Everything good morning. Okay, no specific questions are there. So all good mornings.
Namaste, sir.
Yes.
Namaste, sir. Dr. Prashant Jain, this side from Delhi, sir.
Yes, sir.
Sir, I wanted to ask that all these courses are for the residents of India or for global persons? Like whoever from any country can join these courses.
As I clearly explained that this is not for a Indian government because BAMS degree is already giving. They can take the lifestyle consultant program. Okay. Ayurvedic practitioner program, they can take it. But they have to follow the norms and conditions, licenses and everything according to their own country. Otherwise, there's Ayurvedic lifestyle consultant, 500 hours of practicing there, complete, and they will put it next to your board. I want to have a license.
Yes, yes.
Do you allow them to practice in your country? No. That's the thing. So you have a clear picture. If anybody interested in Ayurveda studies in your country, India, Nepal, and Sri Lanka, they have to go through the 5.5 years full training program. Don't encourage them to study any online courses or anything.
Okay. And so these all the courses would be affiliated through the same platform, or any university would be there who affiliates the course?
We are working on that. We are working with the universities and everything. We are working with the universities and they will take this is the platform we are creating. Anybody can do it, like in the Maryland University of Integrative Health. Now recently in Puerto Rico, there are somebody institutions are there. They wanted to start their program. We are giving the guidelines like a CCIM. ISM, that similar way, we are giving the guidelines for the people, public. Awareness, what is the difference, what is the scope of practice, how we practice, how the things are there, how the legalities has to be followed, everything we are giving guidelines for them. So once they are there, individual schools can implement and they are recognized by these things like that. Like you cannot start BAMS course in your home.
Right.
Make sense? Can
Yes,
you start BAMS course? No.
No, sir.
Same way. So, but if you are affiliated with the campus and the universities and everything, then you can do it properly. Same way in America, other countries where there is no license for anybody. But this is also guidelines for the government of USA also. These guidelines can be followed. That tomorrow, if Minister of External Affairs, Mia, will contact us, we'll be happy to give these guidelines to them. These are the guidelines, we have to identify them.
So currently we are just formulating the guidelines, but
Exactly.
yeah, so there is like
So,
no.
have you watched our first video?
No, sir, I was not there in the same.
Exactly. If you are not there, first watch that one, then you can ask questions.
Okay, sir.
First visit the 2 hours lecture we have given. This is the second. Okay. Good. Any other questions?
Good morning, sir. From India, I'm calling.
Who is Hema Shah?
Yeah.
Yeah.
Namaste, sir.
Yeah. Namaste.
I am MD Ayurveda from Jagadhar University, Jagadhar, and
Your voice is not clear. Please. Your voice is not clear. Can't hear. We can't hear you. You can write a question, your question in the chat box. Okay, thank you. Make sure that this is all recorded. Make sure that qualities, the presentations are there. And good. Now, yes, anybody?
Namaste, sir. Professor Kalpana Sathe from All India Institute of Ayurveda, Goa.
Okay.
Sir, am I audible?
Where are you?
Yes.
Kalpana Sathe.
Sir, may I know Yes, sir. Yes, sir. Will it be a full-time course or part-time? What
That's
the
the thing.
participants or the
We are going to
students who are joining?
we are going to discuss later. This is not ending. This is the only second. This will be a 10 series of lectures.
Okay,
10 series of lectures.
okay.
So
And
you
will it be on hybrid?
we'll tell you all the details later. This is the outlines we are giving.
Okay.
Understand the situation. So when are you starting and everything, it will come later. How much it
Okay.
costs, how much these things. And also we are trying to do MOUs with various universities in India and Nepal and Sri Lanka, and this university faculty members and their faculty members, they have to influence with them, and we are creating a standards of the template for the MOU with them, universities, because once we train our students in the Western countries, where they will go for clinical training,
Yes, of
they have to
course.
go to India or Sri Lanka,
They are
Nepal.
most welcome.
They have to go to India, Nepal, Sri Lanka, 3 countries where the full
Yes.
training programs are there. And whether these colleges are well established or not, whether they have patients are there, regular patients are there or not, what is the specialty, what type of cases they are seeing, records and everything. There can be a medical doctors who may be interested to come. And they wanted to have clinical studies are there. They will challenge you. You challenge them. That's the way it works.
Yeah, yeah.
You challenge
Hmm.
both of them like that. Sir, this is the way we treat them. No, we do surgery, sir. We do hemorrhoidal surgery. Like how you do it in America, we do the same thing. No, we wanted to have a specialty, our specialty. And
Yes,
how the cases are there. How the Chara Sutra is done, how many cases of Chara Sutra is done properly, and how the recurrences happened, how the complication developed. This all documentation has to be there. So then only it can be done like that properly. And the same thing with gynec issues and also herbal formulation, Dravyaguna, Rashi Shastra, and cases are there. Everything has to be done, not theory. Theory, people can buy it. Chaukamba, you contact them, all the books will come in your doorsteps. You pay $50,000, all the books will be in your doorsteps.
Okay.
But whereas the clinical practice is important, people who have to spend time, they need to be competent. Our students are competent. Theory level, 100% they learn very well. And then only they can allow to go to India and Sri Lanka and Nepal, where the countries they belong to, they can choose their own country, but we will create an MOU with institutions, individual institutions, through the government of India. We will communicate with the institutions, government of India. We will communicate with Ayush Ministry. And then we tell them that this is the training program we are launching. So and so person is teaching from this institution, and we'll create an MOU with them, and our students can come and we'll see satisfactory things are there. If they're not satisfied, we'll discontinue our MOU.
It's a good initiative, sir. Very good initiative, and we would like to welcome
Thank you.
all to All India Institute.
Thank you.
And Goa is the best place, I think so.
Thank you.
Thank you. Thank you very much.
Good. Any other questions?
Dr. Shekhar, I have one question. This is Dr. Buchi Gulati. I have my own clinic in Noida, which is very close to Delhi. It's a Panchkarma center. So in a Panchkarma center, you know, there are few new patients every day and some of the repeated patients. I spend almost an hour, the way you were saying, for the patient in the initial consultation. So the initial per day patient that I would be seeing would be 4 or 5. So would an MOU be signed for a clinic like mine?
Yes. Yes, it's possible, because the reason is there are some students who wanted to go set up like that individual practice, like the practitioner. They wanted to go in person. They wanted to see, opt for the not colleges like that. They wanted to go individual personal attention like that. They wanted to get the training program with the individual practitioner, and they can learn, they can practice that way, and they learn. Sometimes some group students, they can go and training, and they can also connect with the MOU with us. No problem.
Second question, Dr. Shekhar, I have been there in the Ayurveda Day celebration. So twice I've spoken on Apna, but not 3 times.
Not necessary. You can submit it. Okay. Still, what we are trying to do, this is the only initial stage like that. What we are doing, not on the basis of criteria, not only that, we are also further, we are reviewing like that. We will be sending after finishing of all our video training programs, our Zoom meetings are there, and we will make them to listen to all the video recordings and basic understanding and everything. Once they're done, then after that they have to do individually, they have to send one specialty video clip for us, complete video clip for us. Then that committee members will review it. Your video clip will be reviewed. Once the video clip is reviewed and you can put your photographs of the center and everything, we can create MOU with you. And after that, you will get a benefit of that way. Students can be getting training program like that. Then we can accept you as a faculty member and everything. And mainly, and then you are able to teach the course with the completely what is the theory part, what is the practicum part, how the questions and everything. There's a lot of work has to be done. That's not like that simply.
Currently, I teach multiple students who come to our clinic from various countries.
I think we'll discuss all things. We know that what you do, we will ask all the details about that, and everything we'll explain to you in a format is there, complete format is there. In that format, what subjects, what specialty you are going to do cases like that. Okay. So we treat every case like that. Cancer patients also we see, then we will send you pancreatic cancer patient to you, then you treat them. Otherwise you will be, license will be suspended. Okay. So make sure that a lot of people, they challenge themselves like that. I can treat all the cases like that.
Oh,
But
I
when the
can't.
reality comes, when the reality
I treat only those patients the way I experienced for.
Exactly. So that's the thing, is very important that way.
Thank you,
We
Dr.
don't
Shekhar,
want-
for all your time.
Welcome, welcome, welcome. Thank you, Ruchi. And this is really, because this is the thing is very important. Our strengths we need to know. Every person should know about their strengths. They can teach anything, not like out of pocket like that. They are coming like that. They have to be well prepared when they are going to the class and teaching the classes like that. I always be prepared for that as much as possible. And sometimes I may have very little knowledge. I may give small knowledge like that. If somebody asks me, can you explain to me about Chara Sutra? No, I don't. General information I will give. I will not able to perform this Chara Sutra on the individual. So I have my own scope of practice. My scope of limitations are there, very clear. So yeah, we are going to ask you, we are going to outlines, we are going to put, we don't give a spoon feeding for individual. We are not going to give a spoon feeding for all of you. Come on, sir, syllabus, write it, PowerPoint, you create it, just we come and show up for you and we teach class. That I can do it. If I do the PowerPoint and presentation, speaking and everything, I can do it. So why should I hire you? You have to have a talent to prepare it like that. And you are able to create it like that properly, then only we can teach. Otherwise, you are not an incompetent person. Like, sir, I tell the people to study Charaka Samhita. Anybody can tell. Ashtanga Hrudayam. Ashtanga Hrudayam from first chapter to 30 chapters, all chapters can read it. No. We wanted to have critical thinking. If you are talking about Pilapakavada, Pitrapakavada, for example, you are talking, what is the way you explain? How your specialty is that? How it can be applied in clinically? That's the way you have to teach them. So you have to be prepared for that. Then only you are able to teach. Not like India teaching. India, previously your teacher has taught you some course material, and same thing you are taking and you go there and teach the class. The quality of teaching is also very important. And the quality of pay, I think, only they can give the remuneration. Salary will be paid on the basis of the remuneration. That is going to come soon. All the Ayurvedic colleges and will get the same thing like that. All the teaching and clinical practices and everything is going to come. It's not going to stop. Modi is going to listen to these things. So Modi ji knows what is going on in the college, every college. He doesn't need to visit individual colleges. So we need to know that the quality of presentations are very important, teaching and time factor and everything is important, like that how they teach in 1 hour class, what they taught, what is the outcome they came. what they learn, students learn. Everything has to be taught. And students are satisfied or not. How many colleges they take the students' evaluation by the for the teacher? How many schools and colleges are taking the evaluation of the teacher? Yes, we are examining the student and failing and passing. How many teachers are failed? That is also to be evaluated properly. So this is the things we have to think about that way. Future is coming and people are paying a lot of money for the studies of education in the medical schools. If they wanted to get a good students to come out of the school, then that's the only way. Simply attending the classes and passing the exam is not important. Here, clinical practice is also important. Competent, successful practitioner is important. Like a Ruchi Gulati, on her own, she is practicing. Not affiliated with any institution or university. That is the thing, solo practitioner. So responsibilities is very important here. How well you are teaching. If you are asking that how much money you are paying, you are out. You are out. We are not giving any money. It's a voluntary service. Are you ready for that? What is the benefit of it? Your long-term benefit is that you will be getting connected to the globally. You will be able to teach globally. We do the conferences, individual 57 conferences we have conducted. More than 6,000 speakers participated worldwide. So we are doing the activity ourselves, and how busy we are, still we are practicing. And so the only committed faculty, we don't want to have too many faculties like that. We want to have committed faculties who come and teach the program properly and structure the program. It's clearly mentioned there, everything that they are able to, this is the common thing we are discussing. And after that, we put them together and all the videos they have to watch. And after watching everything properly, then they will come to the meetings. They will have another form will be there, separate form will be filled. Have you watched all the videos? Question. Have you watched all the videos conducted by us? And if yes, then you are allowed to come to the meetings, future meetings. And then we will take the people who are going to start the programs like that, educational programs, MOUs created in the institutions, and individual faculties who are there, we create the institutions. Because the reason is that why we are taking, there's a lot of segments are there. We have to teach the program there. In this, we are already creating outlines. I have 100 pages of outlines are there. I never keep quiet. I writing material, outside of materials like that. So we have all these things are there. How many hours? Ayurvedic lifestyle consultant. Theory, 310 hours of training. In 310 hours of training, what they are learning every hour, hourly basis. We have to put together. In first hour, second hour, third hour. In theory, what they are learning. And 190 hours of practicum, what they are learning. In 190 hours, what they are learning. So totally is 500 hours of training. Then only they will be eligible to get the Ayurvedic lifestyle consultant. Who is teaching what? And what is assignment? What is the assessment? Student assessment has to be done properly. So we wanted to create a document properly in a systematic way to work on that, and quizzes. Students has to give a presentation and they have to follow the guidelines, their own guidelines. Commitment. So only committed students only can learn this knowledge, Ayurveda. Ayurveda is not for just only, it's not like a science, other courses like that. Ayurveda is a life science. One has to learn properly, they practice, implement their own practice in their own life. That's important. Good. So I'm going to stop here and then we'll have a second meeting will be there. Next meeting will be there again. And if you wanted to continue, I can continue. If majority people are here, I will be happy to talk about, share the screen. I will share the screen with the next level. Let us see specialty subjects. So the specialty subjects. Ayurvedic food and nutrition consultant. Ayurvedic food and nutrition is 1,000 hours of training program. That means 500 hours of lifestyle consultant and prerequisite and additional 500 hours of training program. What is the scope of their practice? What they can do? Ayurvedic food and nutrition consultant. We are not calling it the dietitians. Dietitians are licensed profession in America. Nutritionist is not licensed. Ayurvedic food and nutrition consultant. Ayurveda is food. Ayurveda food, ahara. We are talking about ahara. So individuals should have comprehensive holistic approach to health and disease. That is an important thing. Second, focuses on rasa, guna, virya, vipaka, prabhava, karma, and of various foods. For example, cilantro, aram, coriander. What are the qualities of cilantro? Rasa, guna, virya, vipaka, prabhava, and karma. At the same time, coriander seeds, how can be utilized? So that's the way you need to do it. Healing the mind body through food as a medicine. Healing the mind body through the food as a medicine. They should not touch anything herbal formulation. Sir, I wanted to learn about triphala. Triphala is a food. No, we don't consider as a food. Triphala you don't eat every day. Morning wake up, you don't take triphala. You take the food. What type of food you eat, and that food also to be compatible, incompatible foods, and everything they have to learn in 500 hours of training. Thorough knowledge of various spices and condiments. That's the thing important. Able to guide, recommend appropriate food recipes for various disorders. So various diseases, conditions. So World Health Organization has put together a program called Ayurvedic Dietetics program. Ayurvedic dietetics is different from the Ayurvedic food and nutrition program is different because we are not calling it the dietitians. You cannot use the dietitian word in the Western countries. Able to guide appropriate recipes, able to work with the licensed registered dietitians. They are able to work with the dietitians and nutritionists, the licensed professions. Able to demonstrate different cooking methods for clients on the basis of the Agni, Ama condition Shrotas. This is the thing is very important. So according to Agni condition, Ama condition, we know that 4 Agnis are there. Basically 4 types of Agni, Samagni, Vishamagni, Mandagni, and Tikshnaagni, all the Agni basis. How the Agni can be taught in the condition, Ama condition. What are the Ama Lakshanas, Nirama Lakshanas? What is the differentiation between these things? And then Shrotas. What is Shrotas conditions? Imbalanced conditions. On the basis of that, Shroto Suddhi, and how to do Suddhi with a proper giving of a diet guidelines. Then Panchakarma technician or Panchakarma therapist. Panchakarma therapist also should go for 1,000 hours of training, prerequisite to the lifestyle management. Scope of practice. An individual should have proper knowledge of the individual's indications and contraindications of each and every therapy performed during the Panchakarma therapy. They should know everything Panchakarma therapies and each and every procedures and process like that, everything they have to do it. Therapists should know about simple and effective remedial measures if and when complications arise. For example, a person having a severe bloating of the stomach, Admana, they should not be panic. Dr. Saab, come on, when can you come and do it for me? He is able to handle it in hot water packs or some Udavarta and Admana condition. There, what type of a simple formulation can give? Rectal suppositories. So if he is having constipation is there at that time, the bloating is happening, he has to put a glycerin suppository or Ayurvedic suppository, which can relieve the impacted stool. So otherwise, some people having complications develop. For example, particularly in the Panchakarma therapies, people can develop the complications. And those conditions also one has to properly handle it properly without having any fear. Closely work with a well-trained Ayurvedic doctor. They have to work under the doctor supervision. Must meet with the state requirement regarding the massage therapy licensure. So in the various countries, a lot of people, Panchakarma people, sir, I trained in Kerala. I have 4 years of experience in Panchakarma therapy. I wanted to come to America, work under you. First of all, when you wanted to come under work here, you need to pass the exams here. You need to spend money and study. And you have to take a massage therapy course. License, state license, you have to get it. And at the same time, you have to take a professional liability insurance. Also has to be taken. Any lawsuit comes on you, we are not responsible, you are responsible. Lot of things has to be done properly. Then only you can practice. Lot of people in America also, Ayurvedic practitioners, they practice Panchakarma without having proper training program. They have known about the Panchakarma. One lady asked that, I asked her that, what are the 5 Panchakarma therapies? Sir, 5. 5 is 5. That's it. What is 5? Can you tell me 5? Sir, vomiting? We don't do it, sir, in America. That's it. I think something is there, sir. I don't understand that. Oh, yeah, elimination. Second one is elimination. And she is a Panchakarma therapist. They do not know proper understanding of the knowledge. This is the thing, is very important that the scope of practice is very important. They have to, and I ask them, what are the complications develop? How do you do it? Handle it? No. Marma therapy. Marma therapy is just to put the oil in the body. Not like that. They have to have a thorough knowledge about the meridians, various meridians. How many meridians, nadis and everything, and 107 marma points. And some people, they take the courses, short courses, and then I'm a marma therapist, marma expert. So I teach courses, 16 hours courses, understanding about the basics of the marma therapy. 16 hours courses. 16-hour courses, we teach all 107 marma points. Saptottaram marma shatani, 107 marma points. So those points, how they correlate to the body, how they are, there is a subtle therapy, very powerful therapy. One has to be taught. The scope of practitioner. An individual must know detailed surface of the anatomy, structural anatomy, the surface anatomy. They need to know surface anatomy is very important. Without knowing about surface anatomy properly, they cannot practice as a marma therapist. Structure and functions, origin, incisions, and everything they have to know. Application of gentle, effective pressure on the marma points. They should not press too hard, and very gentle and effective way. And understanding the application of various herbal oils, essential oils, aroma oils, herbal paste, lepas, upalepas, and poultices, and everything. So Ayurvedic approach of using of various essential oils and aroma oils, how the essential oils work in the marma points, what is the benefit of these things? For example, Stapani marma or Shanka marma, what type of oils can be applied? Can we apply these oils? How the dilution has to be done? And thus all these things they should know. Not provide any marma therapies for private parts. This is also very important. There are certain marma points are there. Vitapa marma, Guda marma. Okay. These are the Vitapa marma and Guda marma are perineal area. And one is Guda, rectal area. That cannot be performed marma therapy on that area. They have to be very careful. What are the other alternatives? Then you should know all the details. Private parts should not be touched. And bring energy, healing in the various marma points. So when you are touching the person, when you are feeling the person, you have to feel the energy to them. They feel the relaxation. Full relaxation is important, not distracted. It can be done about 45 minutes to 1 hour, 60 minutes of session. No specific mantras for various marma points. They also should know about the mantra, specific mantra point, mantras. And mantras can be healing qualities are there. There are specific mantras can be used for the marma therapies. Most must meet state requirement regarding massage therapy license. So they need to have, because you cannot do the naked body or you cannot do on the clothes. Marma therapy cannot be done on the clothes. It has to be done and well draped properly and systematically, then only you can do it. It is not done, systematically not done, and it will not get proper results. So it has to be properly done. So that has to be trained properly in their training program in the Marma therapy, 500 hours of training. And next, Ayurvedic yoga therapist, 1,000 hours of training, 500 hours of specialty training, and prerequisite of the Ayurvedic lifestyle consultant program. Ayurvedic yoga therapist, scope of practice, an individual able to incorporate principles of Ayurveda and yoga in the client's healing journey. So here we are not calling it the physical therapist. Physical therapist also share the same platform, and chiropractor also, and things, osteopathy doctors also, they give same thing like that. Some of the things are there. Here, yoga therapy. In the yoga therapy, the patient, the client is touching the therapist, and they are giving the gentle procedures, not like a very strong positions like that. They need to know about how to handle it. Demonstrate specific yoga asanas and assign individual regimen according to their client's prakriti and vikriti. So imbalances, and they should know prakriti, imbalanced conditions, vikriti conditions, they have to be done. Incorporate more doshas and subdoshas, balancing yoga, individuals and groups. And also must be registered yoga teacher, either 200 level, 500 level, plus certified yoga therapist if they are certified, because now in America we have an IAYT, International Yoga Therapy Association. They have implemented some good guidelines for the yoga therapist training program. Then they can incorporate Ayurvedic therapy called yoga therapy is very important, like that they can learn. Ayurvedic doula therapist. Doula is a 1,000 hours of training with 500 hours of special training, and also specialty training, and 500 hours of Ayurvedic lifestyle consultant program. Then Ayurvedic doula therapist having an excellent training program certification, and they provide the guidance and support the pregnant women during the labor. So during the labor, recently somebody contacted me, Dr. Shekhar, my wife is pregnant. Now I wanted to looking for the Ayurvedic doula. Ayurvedic doulas are not many available in America. In California area, that side available more, not in this East Coast area. So what they do, they have a nurse practitioners and midwives, and they have a holistic approach of the midwifery. Then those people, they can also provide it like that. They are able to provide like a dhatri. This is called a doula, is nothing but a dhatri. Dhatri doesn't need to have a license. Like a mom, it's like a mother. She treats like a daughter of the pregnant woman, like a daughter, and treat her properly and everything. Provide emotional and physical comfort and support before, during, and after delivery of the labor. Childbirth in accord with the Ayurvedic science and philosophy. They need to have mother and child care. Mother and child care certification is required. Extra certification training programs are required. Able to provide simple and effective home remedies. Simple home remedies. So now they need to know about cooking skills, nutritional meals for all stages of pregnancy. If, for example, if the pregnant woman having an ama condition is there, or if the baby, after delivering of the baby, the stanya is not coming properly, she is not able to lactating properly, and the milk is, whenever the baby drinks that milk, and the baby is vomiting, not able to throw up, or he may get a reaction to the skin, or some allergens are forming in the breast milk. How to purify the breast milk, stanya shuddhi, how to do it. Simple things, like for example, fenugreek, dill. These are the special things like that can be used for the cleaning of the breast milk. This is the thing is important also. And how to make different types of peya, vilepi, manda, all the varieties of things. In addition to that, there is some halwas. They can make some halwas, which is strengthen the pregnant woman. Various things can be talked about that. So this is systematically they teach about that, how the recipe has to be there. What are the recipes can be followed? Sesame seed laddus, tahini laddus. Where are different type of laddus? Almond laddus, walnuts, dates, different types of desserts. And according to dosha condition, vata, pitta, kapha conditions, and pitta prakriti, what type of things can be given. And even they are able to, They are not administering anything internally. They are not giving bastis for the patients. But a licensed profession can be done, and they can educate them. And then they can do it some certain types of therapies like that before, during, after. This is the thing is important, doula's role. Ayurvedic polarity therapist, 1,000 hours of training and 500 hours of specialty training, as well as prerequisite of 500 hours of lifestyle consultant program. The scope of practice, an individual able to look at the human body as a health through the holistic principles of Ayurveda. The holistic approach is important here. Mind, body, proper meditation techniques, hands-on training, nutrition, yoga, exercise provides realignment. So realigning the body, structure, realigning the body properly and systematically. Work with massage therapists, physical therapists, chiropractors, osteopathic doctors, and bring the holistic approach to health. This can be polarity therapists, can work with them, must be licensed health professional. So because they are touching the person and everything, they should be licensed in any other modality. Like there is no licensing authority for the polarity therapy, but they should have a massage therapy license, or osteopathic doctor, or physical therapist, or aesthetician. Somebody is there who has a training program, prerequisite is required there, then only they can eligible to do polarity therapy. And there's the polarity association is there, and that also we are taking some guidelines from them. Ayurvedic herbalist is Dravyaguna specialist, particularly 1,000 hours of training, in that 500 hours of training and 500 hours of so basically Dravyaguna syllabus has to be followed as much as possible, and an individual well versed with various herbs, both Western and Ayurvedic herbs. This is the thing is important here. No, sir, we were going to teach them Jatamansi, Ankola, and Jivanti, Vrishabhaka. All things are not available in the Western countries. What we do? We have to have understanding about the various herbs which are available, like echinacea, kava, or artichoke, artemisia, all the plants which are there, nettle, various plants, sapamato, hawthorn berry, all the various plants, rasaguna vipakas, and everything they have to explain. And know about various herbs, herb and drug, and herb interaction. What are the herb and herb interaction? Herb and drug interaction they should know also. Like for example, licorice. I'm giving an example of licorice, estimado. If a person having a hypertension, we don't recommend them to take it. Certain types of medications cannot be given. And at the same time, they should know also rasa, guna, virya, vipaka, prabhava, and karma of the individual, of the herbs and everything. Understand the effects of various doshas, dhatus, malas, agni, ama conditions. And understand the various subtle energies such as the sattva, rajas, tamo, gunas. The gunas also. Thorough understanding toxicological effects of the various herbs. What are these toxicological? What is the dose and everything they have to know thoroughly, and practical knowledge, herbarium and plants, visitation of the herbal gardens and everything, identification of the plants and everything. Because again, here they are not going to become a gardeners. The gardener knowledge is extra knowledge, but we are not training them as a gardener. We are training them herbalist. Ayurvedic pharmacist. Ayurvedic pharmacist having 1,000 hours of training. Again, same way of 500 hours of training and prerequisite of the 500 hours of a lifestyle consultant program. And individual pharmacist, APH, that's called APH, Ayurvedic individual expert in the dhatus and malas, agni, ama, and know about the purification methods as per the samhitas. So that is the thing is important. How to purify the gugulu, how to purify the triphala, how to purify the hing, simple things. So herbal proper purification methods also they should know. What changes are happening? Simply purify it. Why we have to purify it? What are the chemical structure is happening? What changes are happening in their structure? That is also should be known. And knowledge about the dosage and side effects, herb and drug interactions. and herb interactions. These all things also should be known. Knowledge about the indications and contraindications of various formulations. This also various formulations they should know. Understand the correct timing of the taking of the Ayurvedic formulation as per the Samhitas. So as much as possible, they should know when to take it. Some of the medicines are given before food, after food, during the food, and muhur. There's the various times, the 11 times administration of the herbal formulations are given. That also should be known. Ayurvedic aromatherapist, 1000 hours of training. So we are giving the proper clear guidelines for these things for the Western people who are practicing Ayurveda and Ayurvedic practices like that, what their specialities are there, how we can provide it various training programs to them. So a BAMS graduate or MD Ayurveda person cannot able to teach the aromatherapy. They should have a little bit of more thorough knowledge about the Western herbology, also more these things, and aroma oils can be used. Aromatherapy is individual. It's a very well trained and practicing in the Eastern European countries, particularly in Germany, France, Switzerland, Italy, and other countries where the aromatherapy is in England also very popular. Aromatherapy licenses are there, and individuals well versed with various herbs, both Western and Ayurvedic herbs. Incorporation of health and well-being, know about the various herbs and drug interactions, and know about the understanding of the aromatherapist dosha dhatu malas and agni shrotas and ama, and able to formulate, make single and a special blend of aroma oils therapeutically, and they can make it like that. And at the same time, thorough toxicological knowledge about the various aroma oils, indications and contraindications should be known. So various herbs are there. Some of the aroma oils can be abortifacient qualities. Sometimes people may develop some headaches and migraine headaches, those type of aroma oils are there. And people who are having anosmia, that is a loss of smell, and hearing problems, tinnitus, those conditions also what can give this aromatherapy as therapeutically. Ayurvedic psychology consultant, which is 1000 hours of training again, and 500 hours of special training program, as well as prerequisite of the lifestyle consultant program. Scope of practice, Ayurvedic psychology consultant, scope of individual must have manas, qualities as per Prakriti and Vikriti. The mind should be understand properly, incorporate Ayurvedic counseling skills and methodology. This is the thing is important. Psychology consultant, Ayurvedic counseling skills are very important. Proper knowledge about Tantra Yuktis or understanding of the mind. That's the thing important. Utilizes sattva, rajas, tamo gunas, and they improve the qualities of the individual client of the mind qualities, sattva, rajas, tamo gunas, and their subdivisions and everything, qualities and everything. And they also apply the principles of Sattvava Jaya Chikitsa. Important, Sattvava Jaya Chikitsa. So we have 3 types of Chikitsa is there. Chikitsa treatment, Sattvava Jaya Chikitsa, Daiva Vyapashaya Chikitsa, Yukti Vyapashaya Chikitsa. Yukti Vyapashaya Chikitsa, which is we are giving all the Panchakarma therapies, massages, surgical procedures, and all the Yukti Vyapashaya Chikitsa. Sattvava Jaya Chikitsa, which is adopted by the Ayurvedic psychology consultant. Daiva Vyapashaya Chikitsa, which is controlled by the particularly the people who are meditation teachers, and as well as people who are having Jyotisha people. Those are the people, Daiva Vyapashaya Chikitsa, they are going to Manimangala, Balyapahara, Homanima, Prayashchitta, Povasa, Pranipada, Gamanadibihi. There are 13 types of varieties of the mantra therapy or the chikitsas are given. Then coming to this, I will expand beauty therapy. So 1000 hours of training, and Anjum is brushing teeth. And we can see, everybody can see her. 1000 hours of training, and Ayurvedic training of 500 hours of training, as well as prerequisite of the 500 hours of training. Ayurvedic expand beauty therapist, an individual able to understand, explain the clients about Prakriti and Vikriti, imbalances, able to perform beauty therapies with natural ingredients. So now Western cosmetology and aestheticians, they use a lot of chemicals. Now, holistic cosmetologists and holistic aestheticians, they use natural ingredients. For example, avocado, almond oil, multani mitti. Those are the things, various things can be naturally available. Those can be used. Customized formulations based on the imbalance and doshas and subdoshas. And emphasize the inside to outside by educating the clients on the importance of the proper diet and lifestyle and beauty. So this is the thing is important also, inside beauty, outer beauty, inner beauty, and everlasting beauty. They must have a licensed esthetician or cosmetology training is required. So this is the thing is very important. The principles of Ayurvedic lifestyle consultant as well as the esthetician training program is also additional training program they added to that. Vedic Vastu consultant, 1000 hours of training, Ayurvedic lifestyle consultants, and Vedic Vastu consultant, an individual well-versed in Ayurvedic concepts of applied knowledge of Vastu Purusha. Vastu Purusha is very important, how the structure is there. Our Vastu recommendations, personal, family, residence, and offices, etc. They should know about that. Also able to provide simple, elegant, and practical Vastu homes and offices in the design, like that. And also work with in conjunction with the licensed architects and licensed builders. So this is also licensed profession in the Western countries. One has to work with the licensed architect as well as the licensed builders. They can work with them collaterally with the Vastu recommendations. Vedic astrology consultant. So 1000 hours of training and prerequisite of the 500 hours of training and 500 hours of this training program. Vedic astrology, scope of practice, an individual able to analyze individual prakriti and vikriti of the individual, and also able to provide astrological remedies on the basis of the natal chart, that they are able to do it, understand the individual local effects of them, and also apply Jyotisha principles according to that, according to the country, according to the principles, according to the lifestyle, and everything like that. Like Panditji is saying from India that you can take some cow's urine, sprinkle in your home, entire home. That is not correct. Disinfection. And it cannot be done properly. Or otherwise, take the cow dung paste, apply in your home, on your bed, apply on your head. No, you can't do it. Provide Ayurvedic medical astrology and recommendations of simple yajnas and mantras and yagas and talismans. Those are the things can be recommended. Simple things which can be provided like that Vedic astrology consultation programs. So this is the way we teach the program. And finally, it comes with the last program, 21st certification program, meditation and spirituality instructor. So 1000 hours of training, 500 hours of training, and prerequisite of the 500 hours of training in the specialty. An individual should practice Ashtanga yoga, practice regularly themselves. Yama, Niyama, Pranayama, Pratyahara, Dhyana, Samadhi, and all the Ashtanga yoga practice they have to regularly practicing. Reading of regular reading of scriptures, easy to understandable way to teach them to general public. They are able to teach everything. Involved in the research-oriented work. If there any research work is there, that is the thing. Has a vision of a Vasudhaiva Kutumbakam, the whole world, the family. Whole world is the family. Like that, they have a proper understanding of the whole world. Provide specific mantras for the individuals and groups. Meditation, spiritual teacher. Impart the knowledge of the universal love. Impart the universal love is very important. These things has to be taught properly like that. So we'll discuss in the next session why we need to get Ayurveda licensed profession, why should be regulated and licensed in the various countries. We will discuss more in the next session, and we'll stop here. I hope it is clear for all of you and people who are not able to listen clearly. And what we do is we record this presentation, we submit it, and we post it on the website. Go to the website called studyayurveda.com, studyayurveda.com, where we have posted this information. It is going on ongoing basis like that. Whoever applied, they will not get the position as an adjunct faculty. What we are doing, application is different. So like you apply for the All India Institute of Medical Sciences, All India Institute of Ayurveda, all people are not admitted as a faculty. So every school having that means you will have 50,000 teachers. All will not get it. They have to take a thorough testings, thorough examinations, and then only we'll be able to assess them. They're able to assess them. Personal interview will be given. So these are the things what once we have taken tasks and everything, we are able to work with them and closely. And then they will have a recognition, proper recognition will be there. We'll give a certificate for them. We recognize them. They can come to the speaking and everything. They can also learn more. They can also learn. You don't know everything. I don't know everything. We are mutually understanding and learning of each other. That's the thing way to learn. Sir, I know everything, sir. You don't need to teach me. Thank you. You can teach in your college, not here. So that is the thing also we are looking for that. We are looking for more. It's not a qualifications we are not looking. A BAMS person can teach the lifestyle consultant program. They can teach. And they can also teach various levels of the programs like that, but they have to have principles properly and communication skills, explaining skills, complex issues, make it more simple, more easily understandable, and logical. Make sure that the person is logically explaining like that. That is the thing is very important. Kadalyena takram na bhunjita. Kadalyena takram na bhunjita. Why mentioned? Now, all the people who are drinking in the Delhi and other places where they're Jammu, Kashmir, and wherever you go there, they put a milk, yogurt, fruits, and fruit shake, milkshake. That is the one creating the ama. That is the one creating the imbalances of the physiology. And what changes are happening? Why we have to should not be explained like that. This is the thing we need to teach them, principles, proper principles. What are the common mistakes we do? And clearly mention that Godumaha Taila Pakwastu Dushtiha Godumaha Taila Pakwastu Dushtiha Drushtinash, and you will become blind. And when you eat puri, if you tell the big bird, puri is dangerous for your health. And how they mentioned, puri should be made with the ghee, not with oil. How many restaurants they serve with the ghee? If you go to the puri, they take oil and they prepare it. So we have to see these principles. So when we know about these things, the basic things, food and nutrition consultant students, we teach them these things. So there are mistakes we do, common mistakes are there. These are called ama visha. Ama can become a visha. So that ama visha can toxic in the body. That is cause for the various problems. So mental problems, physical problems, health problems, and everything. So we have to be extra careful how we are. So science is beautiful. We are not able to understand. That is the biggest problem. And the teachers are able to teach this knowledge to the students properly. Otherwise, it's lost. Knowledge is lost. We have to make sure that we teach our students, and government can authoritatively put these things together properly and everything, why they have to do it. And that is the thing is there. So what changes has to be done? Dietetics is important. Ahara, Vihara, Aushadha. Ahara is the first important, and Vihara second level, and that finally it comes with the Aushadha, medicine. If the patients are asking me that only medicine, I don't give them. First, they have to follow the ahara and vihara and then aushadha. Modern medicine is different. Modern medicine, first drug. Give the drug. Test. Drug. So you have tested, you have thyroid problem, glucose, take this one, medicine. How many people are taking a lot of medications like that, Western medications, like our family members, they take the medications, but they don't change the diet. They eat rasagulla and diabetics, rasmalai, all sweet, jalebi, everything they eat. And they take the metformin tablets. Does it going to work? That is the thing, is that people are addicted to the medications. Metformin stopped medication, a lot of people will be crippled. They cannot go anywhere. Like electricity is gone. Like a COVID. A lot of people are dependent on the medications now. Drug interactions, drug side effects. Minimal drugs, short period of time they can take in, but a lot of people having issues. This is the alarming situation. People, we are not dying with infections. We are dying with more and more excessive eating. We are eating too much. All the developed countries are suffering because excessive eating. We are not starving. I don't see anybody starving in America. Not in India also. Not many people are not starving. Now more and more problems are there, cities, more software engineers. There are software engineers making 3 lakh rupees per month. Even the collector also not makes that much money. The bank manager will not make that much money. Whereas software engineer makes more money. 3 lakhs to 4 lakhs package. They talk about package deals. 50 lakhs per year, annum. 50 lakhs, 70 lakhs. I see the matrimonials of the people, how the children, they are putting the things, 50K, 50 lakhs. 70 lakhs. My daughter makes 70 lakhs. That's the way they talk about that. And what about the health? No. They have PCOS. Daughter having PCOS, they cannot produce babies. And a lot of people having no time. And a lot of people having no time in this country also. People are coming to see me. And Dr. Shekhar, I don't have a time. Can you give me a magic pill? Do you have a PCOS pill? Polycystic ovarian syndrome. Give me a 1 pill. Can Pushyanaka Churna will help you? No. So this is the thing, is very important for people to understand. It is not a medicine. Ayurveda is medicine, is not working. Magic works here. Magic, I'm going to tell you, magic is that lifestyle, emotions, and all things comes in the lifestyle, and diet, and finally medicine. And 5th one is comes panchakarma. If you are not following these things, panchakarma will not work. So that is the way we do it. We teach the people, educate the people more and more. I love to educate the people more. We'll work on that. Thank you, one and all. And okay, we'll talk about MOUs and everything. We'll discuss about that more. Okay, we'll talk about that more as we are getting more and more questions. We'll talk MOUs. MOUs can come later. By creating MOUs, I have created MOUs, 50 MOUs until now. What is the use of it? I can show you MOUs. I have 50 MOUs. I never visited any colleges. Problem MOU creating is not an issue. It's only documentation for you to show to the Ayush Ministry that my college is affiliated with the American institutions. That's only on paper. Have you done anything work with collaboration? No, nothing. In the meantime, principal is changed. Professor is changed. So it is changing, always changing. MOU creating is a different story. Later we will work on that, definitely. First of all, we need to have understanding of properly and how we can take the faculties like that properly, how to educate the people, how to promote it, Ayurveda, to the globalized. First, you need to train also. A teacher orientation class is also required for you. How to teach, how to present it, how to educate it. Be prepared for that. Okay. Thank you, one and all. Namaste.